We're going to move now to our PaED talk, which is entitled Time for Action, Climate Change in the Humanitarian Sector. And I'm delighted to welcome Rita Issa to give today's PaED talk. Rita is a British-Lebanese primary care doctor and PhD fellow under the Critical Decade for Climate Change program at the University of East Anglia, where she researches the mental health impacts of climate change, and a research fellow in the Climate Change, Migration and Health at Lancet Migration. Rita previously worked with MSF and the WHO Climate Change Department, as well as several other organisations. She co-founded a number of advocacy organisations, and her contributions to the field of climate change and health were recognised as London's Public Sector Individual Changemaker of the Year 2022. It is my pleasure to welcome Rita.
It was getting hotter. Frank took a deep breath. It reminded him of the air in a sauna. He looked at his phone, 38 degrees, humidity about 35%. A few years ago, it would have been among the hottest wet bulb temperatures ever recorded. Now, just a Wednesday morning. The opening chapter of Kim Stanley Robinson's climate fiction novel, The Ministry for the Future, paints a harrowing scene where, faced with an extreme heat wave, residents wade into the city's lake in an attempt to find respite. Many die. For the humanitarian worker protagonist in the book, the event is deeply traumatizing and it changes the course of his life forever. What is described is sadly not fiction, an increasingly likely future, and for some, experiencing flooding and heat waves in Pakistan or wildfires in Spain, Portugal, and the US, a very tangible present. But what does this mean for us as humanitarians? This relationship is twofold. We know that climate change and environmental degradation impact and necessitate humanitarian response. And meanwhile, humanitarian response also has impact on climate change and the environment. But let's look first to how the climate crisis is a humanitarian one. In the past 10 years, climate and weather-related disasters have claimed more than 400,000 lives. It's affected 1.7 billion people, and it's displaced an average of 25 million people each year. And as I'm sure we're all aware, we know that these risks are rising with more frequent and more intense weather events, including droughts, flooding, and tropical storms. The humanitarian consequences, whether these events are slow onset or rapid and extreme, are major, causing death, disease, and destruction, large-scale population displacement, public health emergencies, and they drive conflict. And so by 2050, 200 million people could require humanitarian aid every year because of climate-related disasters alone. And while climate change hits everywhere, it's always the most vulnerable people who are disproportionately affected, those who face multiple other threats, including being disabled, older, children, women. And for people who are displaced, many move into areas which are climate hotspots, at risk themselves of flooding, heat waves, and drought. And so it's important to us working in this sector that we know the risks. There is a sizable body of knowledge on how to minimize the human impact of many of these events through resilient work, through disaster risk reduction, and by increasing international capacity to cope with disasters. However, as future disasters related to climate change get bigger, happen faster, and affect more people, our existing knowledge and capacity for response may not be enough. There are three types of humanitarian events we can feasibly expect. Known disasters, those of which we already have extensive experience and understanding, but might have new characteristics. They might be greater in scale, in frequency, they might be impacting new geographies, or there might be concurrent disasters alongside them. We might also experience imperfectly understood disasters, those that are in some respects developing along familiar lines, but they may present new or unexpected features, such as hurricanes or cyclones that develop much more quickly or with a different trajectory to usual. And then we have the unknowns, things which might be completely unprecedented. So extreme heat waves. And while we know about heat waves as a hazard, they haven't typically required a humanitarian intervention. And so how do we adapt and respond to that? We also may experience cascading or new disasters, complex disasters that might have unpredictable impacts across economic and social structures. And arguably, we saw this with COVID-19. Countries failed to use the lessons learned from previous coronavirus epidemics. These are events that are relatively well understood, and we were unable to contain the disease, which led to a global disaster with a plethora of socioeconomic consequences. And so while the lessons that we currently have from humanitarian action can be expected to hold good for known disasters, these are far less likely to be reliable or useful for imperfectly understood disasters, and certainly not the unknowns. And so what do we need in that scenario? We need to consider how we adapt and respond. Part of the way that we do that is we identify at-risk regions such as densely inhabited areas or delta regions. We need to develop our ability to design and implement a range of program types: resilience, disaster risk reduction, anticipation and response, and consider new programmatic responses to things such as heat waves. We also need to center constant learning, monitoring and evaluation, updating our knowledge, and being able to be flexible and agile in our thinking. And we really need to embed, as has been said for many years, but even more so at the moment, work across sectors. Health, yes, but we need to consider how that fits into shelter, urban planning, water and sanitation within, for example, the context of heat and heat waves and other extreme events. But climate and weather-related disasters are not inevitable. We are still within this critical decade for climate change where there's still some scope to act. And so we can mitigate the worst of climate change, both by reducing emissions and waste now, and by considering sector-specific preparedness. First and foremost, the humanitarian sector has its own footprint. Much of that comes from procurement of goods and other services in the supply chain, and also through forms of transport and transporting goods, transporting human resources, so taking planes and other forms of transport. The sector itself needs to measure, report, and set targets to minimize the carbon and waste footprint. And we know that MSF has done this already, pledging to reduce our emissions by at least 50% compared to 2019 levels by 2030. One of the ways that we can support this is by really thinking about how we localize and decolonize action. And this has been very much in the sector and in discussion over the past 5 to 10 years. We can do this by promoting context-specific and localized knowledge, supporting local people and increasing local capacity to better understand local vulnerabilities and enable local resource mobilization. And this also reduces unnecessary travel and helps to support decolonizing the sector. It's also a matter of resources. We have the data that we need to be able to predict what might happen, but we need to consider how we use it to support catalytic financing and localized resource mobilization that can be triggered before an extreme weather event even happens to ensure that it doesn't become a disaster and to preserve lives and livelihoods. And at MSF, we're also in the business of témoignage. We must consider how we individually and as a sector bear witness to the climate crisis, paying attention to disproportionate impacts felt by vulnerable groups and aligning diverse experiences with humanitarian, operational, and advocacy goals. And we can also think about how we climate-proof existing projects, remembering that humanitarian response itself can damage the environment, as we've seen with mass deforestation, such as in Sudan, when seeking cooking fuel. And this image shows the Minawa refugee camp in the Cameroon, where tree planting can contribute to livelihoods and nutrition. It can help stabilize the soil, can help retain water in the ground, and also provide shade. And we know that other activities can support both efficiency gains alongside other health, social, and financial co-benefits. And so while the climate crisis has all of the ingredients of a crisis, it's also a brilliant and unique opportunity. The pressure of climate change on the humanitarian sector will shape where the sector evolves into for the next 50 years. This is an evolution that's probably overdue. And so now is the time to take stock, think flexibly, adapt and mitigate, and continue to provide necessary care and resources to the place that need it most within this new paradigm of planetary health. Thank you.
Thank you, Rita, for that quite articulate presentation. Rita will be available during the conversations over coffee in just a moment for any questions. So that concludes today's session. Prevention is better than cure. It's not a new concept. The phrase is often attributed to the Dutch philosopher Desiderius.
Microsoft Outlook app needs your attention.
Sorry. I'll start again. The phrase is often attributed to the Dutch philosopher Desiderius Erasmus in around 1500. But yet for MSF as an organisation, it challenges our very identity. We've long positioned ourselves as a humanitarian organisation that focuses on emergency response and providing healthcare in response to conflict, epidemics, famine and natural disaster. That is changing. Prevention is about tackling the upstream causes of ill health. And so we are challenged to think of novel ways that focus on local eradication, prevention, and detection and early management. In our oral presentations, we heard about predictors of wasting in MAMI patients, a vulnerable group meriting further research. The quality of our interventions was considered in one presentation that focused on addressing systems issues using simulation to improve triage processes, and another that explored community and caregiver perspectives of seasonal malaria chemoprevention. And we heard some promising results regarding early diagnosis of sickle cell disease, a common and devastating diagnosis in many places in which we work. Looking externally to collaboration with institutions is one way to improve the care we provide to our patients and set higher standards of care. And we heard about a great initiative that is harnessing the expertise of our local partners. We just had a fascinating session and panel discussion on strategies to prevent and control malaria, looking beyond management of severe cases that continue to have devastating complications in our paediatric patients, and heard about some great initiatives focusing on disease prevention, vector control, the role of chemoprophylaxis, mass drug administration, rapid diagnostic tests, and finally the potential for vaccinations. This session also highlighted the importance of capitalising on opportunities for prevention at every contact with our patients and exploring synergistic interventions that can be more efficient and not just have a combined effect, but multiplicative benefits. And the session reinforced that, as for so many interventions, community engagement is crucial. And we had some thought-provoking presentations on the role of climate change on human health. Zulfikar Bhutta set the scene this morning by articulating the inextricable links between rising global temperatures and the effect on the environment. Climate change results in degradation in the quality of our soil, air and water, and this has major direct and indirect effects on human health. We're seeing an increase in vector-borne diseases, respiratory allergies and asthma, malnutrition and diarrhea, mental health problems, and population displacement impacting our health service delivery. And those that are most affected are those with inherent vulnerabilities, the very populations in which MSF intervenes. And these issues disproportionately affect our women, newborns, and children. This was brought home in our final session today. We cannot escape the effects of climate change. We need to continue to rise to our charter to respond to the health needs of the most vulnerable and marginalised, whilst minimising our own environmental footprint. The climate crisis is a health crisis. The climate crisis is a humanitarian crisis. I'd like to thank you for your participation today. We've reached the end of the second day of our program. And if you missed yesterday's session, the recording is now available in English and French. We'll now move to our break with conversations over coffee. And it's going to be a very hard choice because there are 3 sessions on offer. The whole of the malaria panel will be available in one room. We'll have a session on climate change with Zulfikar Bhutta and Rita Issa, who will be available for discussion. And in our third session, we have Inma Carreras, who is available to discuss local partnerships. To access the conversations over coffee, you can click on the banner in the auditorium, just below the auditorium, or you can go to the agenda and click on the sessions there. Remember to make use of the other fantastic spaces available on the platform, particularly the networking lounge, where you can connect with your colleagues. There's also the resources library, there's the booths and posters, there's a possibility to reach out and chat with other participants, and there's a photo gallery. So particularly if you're joining the conference in a group, we'd love to see a picture of you all together. Thanks again, and look forward to having you back for tomorrow's session on Neglected No More, which will be chaired by Daniel Martinez.